Right, good afternoon, everyone. Welcome to this webinar on COVID-19 deaths of residents in care homes. And we're going to make a start. I can see that there are some people joining, but there's sufficient number of people for us to begin. I'd like, first of all, to introduce the panelists, who hopefully you can see all of us on the screen. You might have to arrange your view to go to gallery view, which is a button on the top right-hand side, as opposed to speaker view. So my colleagues from Doughty Street Chambers, Aswini Weerer, Sophy Miles, Amos Waldman, and I, we're all barristers in the Court of Protection and Mental Health team, as well as the Inquest and Inquiries team and the Public Law team. And you'll hear from them as we progress. And we have three fantastic external speakers. Subhajt Basu, a colleague of mine. I have a position in the University of Leeds. Subhajit is an expert in law and emerging technologies and has written on how COVID-19 has affected the BAME community. Very pleased to welcome Veronica Gray, who's the Deputy Director of Hourglass, the only charity in the country working to end abuse of older people, and Alexis Quinn, who's an author, a teacher, a campaigner, and a human rights activist. And I'll sneakily plug her book at some appropriate time during the webinar. I know that several participants watching and participating in this webinar have lost loved ones in care homes and in other locations. And so I'd like to start off by, on behalf of all of the panelists and on my own behalf, extending my heartfelt condolences at this extremely difficult time. And may the memory of each person who's lost their life be a blessing. We've put together this seminar because there's quite a lot of confusion about human rights and legal issues in relation to COVID-19 and care homes and people who have died of COVID-19 or other causes due to COVID-19 in the recent months. And so our aim today in this webinar is to assist people living in care homes, their families, and others concerned, such as care home workers and people working in trade union and other organizations, about the different legal processes that we may see in the forthcoming weeks, months, and years. And we hope that the information provided in this webinar proves to be helpful. You will have seen when signing up that we're asking for voluntary donations if you can and feel able to go to the COVID-19 Bereaved Families for Justice group, which my colleague Amos will be talking more about. I'm helping the group as part of their legal team, calling for an inquiry with an immediate interim phase, which you'll hear more about as we progress. The webinar will be recorded and it will be available hopefully from tomorrow or the day after. And I know that a lot of people were not able to join live, as it were, but will be able therefore to view a recording. The format is going to be that it's going to be more of a TV style panel discussion rather than a series of lectures. So there are no PowerPoints, and my colleagues, the panelists, have vowed not to make an intervention which exceeds 3 minutes. There'll be opportunities for you all to engage with the panelists, and you can do that by typing into the chat box, which you'll find at the I'm sure you know how to do that already. This is probably not the first Zoom meeting that you've attended, but there's a box called chat and then it brings that up. You can ask the panelists a question, or you can also use the Q&A, which is the button next to chat. So I'll, at various points, look out for questions and comments there, and raise them with the panelists. So we promised to try and answer or give different perspectives to several questions. First question is why the virus was allowed to rampage through care homes. And we selected that word, rampage, because that's the word that the UN High Commissioner for Human Rights, Michelle Bachelet, used in March when she was talking about closed institutions. We know that there's been a significant problem in the UK. The Office for National Statistics says that 59% of all deaths, involving COVID-19 from the 2nd of March to the 14th of July were of disabled people, and so 59%. We know that by the end of July, it was reported that there were almost 30,000 so-called excess deaths from COVID-19 of residents in care homes, 2/3 of whom died directly from COVID-19. Other data is also alarming, and of the deaths registered as COVID-19 related in the UK, around 17,000, which is 31%, occurred within care homes, and at least nearly 22,000, 40%, were accounted for by care home residents. And we know from the recent few days that the situation, unfortunately, is now in flux again. Two of the largest national care home operators have already closed dozens of care homes to visitors, having reopened them during the summer. We know that COVID-19 cases are rising in care homes as well as in the community, and infections have tripled within the space of just 1 week, with 513 cases recorded in care homes between the 31st of August and 6th of September. So let me ask the panelists, why is this situation occurring? Why has COVID-19 rampaged through care homes in the UK? So I'll turn first to Aswini.
Well, thanks, Oliver. I think there's good evidence of a lack of preparedness generally, and a failure to heed warnings such as that of the UN Commissioner for Human Rights about the risks to people, especially those with vulnerabilities living in congregated care settings. There's been a lack of clear guidance, and obviously we heard a lot about the lack of protective equipment within care homes, especially at the start of the pandemic. I think another factor which is quite important and needs attention is whether and how people in care homes were accessing healthcare. How did they get to see their GP? How did their GP see them? Did they see their GP or other health professional when they were presenting with symptoms, or was there a delay in doing so? I certainly got the sense that care home staff without healthcare training or healthcare backgrounds were left to deal with sick people, which may have resulted in an increased number of deaths.
Thank you very much. Alexis?
I think, for me, part of the reason is that, we're sort of out of sight, out of mind quite a lot, and sometimes a little bit of an afterthought. And for me, I think that the deaths were, quite predictable, to be honest. The WHO, the CQC, and the government themselves, even with their sort of coronavirus bill, it's those documents they created sort of indicated that they knew that problems would arise, and they knew how virulent COVID was. I guess for me, the biggest factor is institutional care in itself and the dynamics of these settings. Having lived in them for 3.5 years, I know that you can't socially distance in them very easily unless you isolate yourself to your bedroom. And the whole point, isn't it, of congregate care is that staff can keep an eye on you. So the only way really to have stopped the deaths would have been to have kept COVID out. And we all know, of course, that didn't happen. In fact, the doors were sort of opened. And when I was living in congregate settings, many people struggled with even getting out of bed in the morning, and regularly weren't able to shower, and needed help getting dressed. And because of our differences and difficulties, like even things like washing our hands for 20 seconds isn't as easy as it sounds. And for me personally, wearing a face mask with my sort of sensory profile is very difficult. And so this pandemic is an additional factor for me in an already very long list of threats to our safety and survival and the integrity of people with disabilities in institutions, full stop. Now, I know, as my colleague has just said, there's been plenty of talk about PPE testing and isolation of infected people. But for me, it's the existence of these institutions themselves, which is the problem, and their dynamics.
Thank you. Subhajt.
Thank you, Oliver. I would start by saying, the government had the political will, but the government spent so much of time at the beginning thinking about herd immunity that they didn't plan for enough. And from a Black ethnic minority perspective, we know that this particular group suffers from diseases like obesity, respiratory, lungs related problem. And COVID-19 has basically made that much more worse. And by end of June, if you look at the statistics, 54% of the death that was happening within the care homes were happening with Black, Asian, and minority ethnic group. They have suffered from health inequalities for generations in this country. They have been overlooked, and an unsympathetic government basically chose a much easier path rather than taking care of this.
Thank you. Sophie?
Well, I think I agree with everything that's been said so far. I think one thing that's going to need some very careful examination when there is a full inquiry into this is some of the guidance about hospital discharges. We know that at the start of the pandemic, there was understandably a desire to get people out of hospital as quickly as possible. And we certainly know that guidance in early April 2020 was stating that only some patients leaving hospital would receive tests for COVID, and that a negative test wasn't necessary for someone to be admitted to a care home. And they were going to prioritise people in critical care for pneumonia, acute respiratory distress, or flu-like illnesses, and places where there already was an outbreak. But it seems, certainly looking at it from the outside, the risk of asymptomatic people being discharged very quickly from hospitals into a care home as a priority to get them out of the system must have something to do with it.
Thank you. Veronica?
Yes, have to agree with everything that has been said to date. Glass would also just add to that. As is so often the case, older people simply were not prioritised at all. And it almost felt that older people were forgotten about. At the start of the pandemic, the government failed to recognise that older people in care homes were going to be vulnerable. And in fact, the government stated that it was very unlikely that residents would contract coronavirus. So that fundamental lack of understanding, complete lack of preparedness, and a shortage of resources just created the perfect storm. I suppose the other side to the coin is the social care sector is so often the poor relation. And I think as the NHS became a priority, our social care sector suffered, and as a result, older people have lost their lives.
Thank you. And Amos?
Thank you. Yes, well, I also agree with everything that's been said, particularly the discharge into care homes from hospitals. I remember reading about a cardiologist who described it effectively as seeding infections into care homes, which is what we did. So the elderly people, in my view, they weren't valued, they were abandoned and neglected. And after early warnings from the WHO, from a number of experts in January, we simply didn't prepare. And one of the things, in addition, which I feel we didn't do was we didn't look at the experiences of other countries. We saw, and we had the advantage of time, that infections were occurring, particularly in care homes in Italy, in Spain, and we didn't do anything about it. And certainly listening to some of the Health and Social Care Select Committee, I remember listening back in May and hearing evidence that struck me, particularly from Professor Terry Lum, who's professor in social care, and he was talking about what happened in Hong Kong. And when we look at Hong Kong, they took a different view altogether. There were no cases in care homes, no deaths in care homes. So we just didn't analyse what was going on, and that was for a number of reasons, whether it was training, and it was a lot of the countries that had the experience of SARS. They knew how to treat it. They didn't treat it as an influenza pandemic. They had training, they had measures in place, procedures in place, and so they were able to control it a lot more, together with reducing community transmission in the first place, because of course if community transmission is low, it's less likely to get into the care homes. But also looking at Germany and their success, I think they were reported by the LSE as having 13 times the number of deaths. We had 13 times more the number of deaths than they had in Germany. And so I don't think we learned the lessons, and we didn't make use of the time that we had, and we suffered as a result.
Well, thank you very much. So, wow, a vast array of topics there. And I'm sure we'll come back to many of them. I just want to pick up, several people mentioned discharges of older people or those needing social care from the NHS estate into care homes. Many of those people will have been older people with dementia. Veronica, I know that your charity Hourglass has been running a helpline for older people and their families. Can you give us a sense of what you've heard has been the experience of older people with dementia in care homes during the pandemic?
Sure. From the outset, I need to stress that Hourglass is aware that very many care homes and care workers have been absolutely amazing and gone well above and beyond in order to protect older people and keep them safe. So I want to acknowledge that. The Hourglass helpline exists for anyone who is concerned about the abuse of older people. So in that sense, we don't hear the good news stories, if you like. And we have dealt with some very, very challenging cases. Irrespective of dementia, older people have suffered greatly. From the outset, we had people contacting us worried and concerned about their older relatives, care homes that didn't have enough staff, care homes that weren't getting their food deliveries in a timely manner, lack of PPE, all creating the breeding ground for neglect of older people. Many callers were concerned about abuse and neglect. One caller described how the care home removed the CCTV from his father's bedroom at a time when visits were banned and inspections effectively stopped, and he had no way to be assured of his father's protection, safety and well-being. For me, the most difficult calls were around the isolation and loneliness that older people were experiencing during lockdown and a ban on visiting, and the resultant physical and mental health decline in their older relatives. And we can't help but feel the distress of families who have lost loved ones. Another caller described to us how her sibling had experienced mental health issues during lockdown, and as a result could no longer care for their elderly mum. Mum was admitted to a care home where she was subsequently sexually assaulted by a care worker. These are some of the experiences that people have been living through and losing their loved ones at the same time. COVID-19 hasn't created abuse in care homes, and we are very aware of that. But equally, there must be a protective bubble around all of our older people right across society, regardless of where they live. Older people have struggled greatly, especially those with dementia, have struggled greatly to understand why they can't have visits. Even the basic PPE that staff are wearing, older people are really struggling with that, the lack of physical contact. So there have been very many different types of challenges for older people during the pandemic.
Thank you very much, Veronica. Yeah, it really struck me that, I mean, the pandemic hit social care when it has already, you know, for several years was fragmented and fragile. And I know that there's around 120,000 vacancies in adult social care. So already a depleted staff, and that's been really interesting to hear the experiences of people who have called the Hourglass helpline. Amos, Can I turn to you, please?
Yes, well, just go back to my own experiences, really. My grandma died in a care home on the 2nd of April this year. She was my mother's mother. She was born in London to parents from London, Swansea, who are their parents from Poland. She was kind, intelligent, Mensa certified, loving and charismatic. She was incredibly talented in music and dance, and she was a prolific knitter. She had a great deal of integrity, was extremely determined and principles, and she used to put me up whenever I travelled from Manchester to London. So she moved to a care home in early March. She'd always been adamant that she didn't want to go into a care home, so it surprised us when she expressed to me that she did. But she was becoming more physically, anyway. She had difficulties mentally. She was still pretty sharp, but she found it difficult to adjust initially in the first week or so, but then she began to appreciate being cared for. But after about 2 weeks, the care home went into lockdown. This was before the national lockdown. This was the middle of March. No visitors were allowed, and it was extremely difficult. Around the same time, we were informed that she was unwell. We were told that she had a water infection. She'd suffered from them a number of times before. Because it was early in the pandemic, we weren't sure necessarily what was going on. The information that was fed back to us was relatively limited. We were told after that she'd been prescribed a course of antibiotics for the infection, and we were only able to speak to her, unfortunately, by telephone. There were no video call measures in place or facilities at the time, and so it was difficult to gauge really how ill she was. The information we gleaned was from care home staff who didn't appear overly concerned, but at different stages after that, we were given varying amounts of information about the state of my grandma's health. We were told the following week she had a chest infection, and she had noticeably deteriorated by then. She wasn't particularly lucid when we spoke to her, and certainly we felt extremely helpless. My sister, who was a doctor, was informed when she spoke to them that all her observations were stable. They said that she wasn't suffering from COVID-19, and we were told that she was waiting to see a doctor again. I'd later heard that she was in a great deal of pain at that stage, but she wasn't provided with any effective analgesia, in fact, until she was given morphine the night before she died. We later heard that 2 members of staff had tested positive for COVID. That was information we received. We also heard that other residents had suffered from COVID-19, but we didn't know the extent of it or even how the infection entered the home. But having the general practitioner having seen her around the time of her death, and then after she died, a death certificate confirmed that the cause of death was pneumonia, the causes of death and pneumonia and COVID-19. And we were told at that time that there was anger. The provider didn't want COVID-19 on the death certificate. But of course, knowing what we know now, how the virus pervaded through care homes, there are certainly things that we wish we'd done differently at times, and we have guilt about that. But at the time, in grief, it was difficult. It was difficult for my grandma, and events took place very quickly. We'd also had some personal issues in the early part of the year, and we placed our trust in those looking after her at the time. But the funeral took place over Zoom during the national lockdown, and as I'll move on to in due course, it's been difficult dealing with it since. My mother and I were shielding in Manchester. My mother was alone, and we were unable to meet the family. So that really is my grandma's experience, and there's a distinct lack of palliative care towards the end. I know from reading about it, there were certainly issues with analgesia and obtaining them. Rules were changed in that respect, I think, later on. But it was an extremely difficult time.
Thank you, Amos, for sharing that with us, and wonderful to hear about your grandmother, her character. She sounds like a wonderful lady, and I know that you're going to come back and tell us about what the difficulties that you and your family have faced. And in the chat, several people have explained their own stories of relatives dying in care homes. People are saying that the care homes lied to them about testing. didn't call them in time, and so on. One of the themes that a couple of participants have raised is whether any of this has to do with privatisation and the lack of unionisation within the care sector, precarious and 0 hours contracts being quite prevalent, obviously. Veronica, do you have a view about that?
I certainly think the staff shortages have contributed to the deaths of older people in care homes during the pandemic, and contributed to the excess deaths that we've seen among older people as well. There is something too around social care not being seen as valuable. We see too often where there is a lack of training for care staff. It's not invested in. It is not seen as much of a priority as the NHS, when actually our social care workers are working in exactly the same proximity to people with older people as their NHS colleagues. So we need to create a parity between social care and health care.
Thank you. Aswini, any thoughts at this stage from the legal perspective about anything Veronica and Amos have said?
Well, yes, I mean, a couple of things come to mind, possibly arising just to explain. Clearly, there's a duty of care to all residents and to take reasonable care, and that must include providing staff who have proper training and background. And to that extent, there is, I would say, some parity with other care sectors or health care, because the requirements, the basic requirements are no different. There's also a duty to assess a person's care needs, so that has to be done on an individualized basis. Being in a care home away from familiar surroundings and people, that creates vulnerability, and risks to health and mental health are part and parcel of that experience. And so that the loss of contact and that impact has to be assessed on an individual basis. And I think we have seen, certainly I know that my colleagues have seen cases where that simply hasn't been happening, and that has added to the distress that people in care homes and their families have experienced. So I know of a case where an elderly woman with dementia had lost a lot of weight and died unexpectedly. And it's not actually clear whether she died of COVID or not, or indeed due to the weight loss, but the restrictions on her husband visiting had been such that he'd been unable to help her feed or to bring her food that was familiar to her, that would have encouraged her to eat. And so he's left devastated by what he feels was an unexpected and hastened death. So, I mean, I just do think that all of these things, that there are, there's the lack of common sense, it's almost a defensiveness that one gets out of some of the responses from care homes when they take these sort of blanket approaches to vulnerable people.
Thank you so much. Just a couple of people in the chat are saying, making the point that urinary tract infections is the sort of go-to label for people who were COVID positive, apparently. There's a question about Section 42 of the Care Act 2014. Sophie might like to give that some thought and answer it in a moment, if that's okay. And then someone else has mentioned the issue of the NHS 111 helpline telling care homes that COVID positive residents shouldn't be admitted to hospital. I've heard that from several other people, and surely that has to be a focus of the inquiry. I mean, so that's essentially, if it's true, would be a whole-scale denial of healthcare to care home residents, which would be incredibly alarming. So we've talked a little bit thus far about older people and older people with dementia, but of course, not just older people who are in care homes. Of course, they constitute the majority of people in care homes, but there are people who are younger, people with disabilities people with learning disabilities and or autism. So I'm going to turn to Alexis to just explain what some of the key themes have been for people with learning disabilities and or autism in care homes during the pandemic.
I think, you know, from my perspective and talking to people, a lot of support was offered, and many of us needed support in the form of like more detailed planning, where, you know, we're used to, for example, like specific routines, and are kind of unsettled by change. And obviously COVID being a humongous change and destabilized, you know, a lot of us. And so for those of us in need of that predictability, you know, understandably it was very challenging. For me though, while there was so much that had changed, obviously our personalities and our preferences and our interests, you know, obviously remained the same. So for me, you know, that good support meant that there was, you know, that we were included in discussions and decisions, and, you know, so that we had the best chances of understanding what was happening, and staying in control of our lives. So that's certainly a theme. I mean, during the lockdown, there was a lot of support. I do think people tried to sort of maintain relationships. For example, you know, where visits were restricted, and people couldn't access the community. A lot of autistic people and learning disabled people weren't able to access the community at all. And it just wasn't facilitated. But I think there was an effort to get autistic and learning disabled people involved in like Zoom calls. And also I know a lot of people where they'd like been used to going to like the cinema once a week or having a movie night, that was also done, you know, via Zoom. So you know, effort was made. There was also, I think, personal hygiene, you know, is a huge issue, which I don't think was addressed particularly well. Social stories came far too late, and I think support was very much a lottery.
Thank you. Alexis, for those who don't know, what do you mean by social stories?
So if I'm used to sort of doing something in a certain way, there'll be like, and it needs to change, there'll be like, you know, like a series of pictures with a very sort of simple written text explanation, just to get us used to the idea, you know, of what would happen sequentially in that change. And it might surprise you, but when I was in hospital, social stories were used, you know, like even for me, because when you're in hospital or in an institution, your functioning can deteriorate quite significantly because you're not in your home environment. And when change happens, you know, I personally become kind of non-verbal. So those social stories came months later, and that could have happened really rather quickly.
Thank you. And one of the other difficulties that people faced was that visits were very quickly banned. Alexis, how did that affect people with learning disabilities or an autism and their families and friends?
Well, I think one of the first things, you know, it might not surprise you that I'm anti-institution, is that there's no eyes on the inside, you know, and all those regulatory eyes, and parents are the biggest ambassadors. Family and parents are the biggest ambassadors. Even just looking at the chat in terms of older people, you know, we just didn't get that support inside. And it's not necessarily, I think, for autistic people and learning disabled, that seeing relatives is super important, but it's also the routine of that. And when that routine is taken away, it leads to overload, it leads to meltdown, and that leads to restrictive practice. And of course, we've seen restraints skyrocket.
Restraints skyrocketing, that has been one of the kind of, I don't know whether anyone predicted it, but alarming side effects of the pandemic. Thanks very much, Alexis. I'm sure we'll come back to you. Sophie, would you like to react from a law point of view to anything that Alexis has said, picking up maybe on the visits, and if you wouldn't mind addressing the section 42 point that an audience member asked and explaining what that is, that
Sure.
would be appreciated.
Yep, well, I will do. So first of all, visits. I mean, I completely agree with what Alexis has said about the, you know, the huge range of importance, range of contributions that visits bring to people who are living in care homes, and good care homes obviously know that. they have been in a very unenviable position. They have had to balance their responsibilities to keep people safe with their responsibilities to maintain their mental, physical, emotional well-being and routine by allowing visits to continue. So, you know, no one would have wanted to be in that position, having to make those kinds of decisions. So a lot of care homes, because of the way in which they've been arranged, might be directly subject to the requirements of the Human Rights Act by virtue of Section 73 of the Care Act. But in any event, the guidance that the government gives to care home providers has to be compliant with human rights. And the two human rights that the government's got to be balancing, or the care home has to balance, is the right to life, Article 2, and Article 8, right to respect for your family and private life, which interference in which must be in accordance with the law and must be necessary in a democratic society in the interests of public safety or protection of health. So really difficult to try and balance that out. At the moment, the guidance given by the government in England is that care homes have to sort of make their own policy. That is not the same in other devolved administrations. So in Scotland, care homes that were virus-free for 28 days could accept visitors. In Northern Ireland, if they were free, you could have one visit at a time. Wales, I think, has been allowed to have people visiting outside. But in England, care home providers have had to create their own policy. On one level, you can see that that might be more flexible. It also does throw the responsibility very much back into their lap, which I think is difficult. So I know that at least one charity has written, this is John's campaign, had written a letter before claim to the Health Secretary on the basis that the current guidance is unlawful, leads to chaos, and there's noted the inconsistencies between the English approach and the approach in the devolved administrations. So that's the kind of the legal position in relation to visits. Just in relation to the safeguarding points, so there's two further parts of the Care Act that might be important here. One is Section 42 of the Care Act, the duty of a local authority to investigate if there's reason to believe that an adult with needs for care and support is at risk of or has experienced neglect or abuse. Clearly relevant, it would seem to me, some of the cases that we've heard about, certainly some of the things that attendees are telling us about in the chat, certainly some of the things that Veronica has described to us. And of course, the other thing to think about is the duty to carry out a safeguarding adults review in circumstances where somebody has died and there are questions about the way in which various agencies have worked together to safeguard that person during their lifetime. So both of those powers seem extremely important. They certainly were not, they weren't removed by the easements and the Coronavirus Act. It's very much in place, and I don't know, and I'd be really interested to hear Veronica's views about this, whether there have been any such reviews or investigations in relation to people who've been placed at risk due to poor protection from COVID.
Thank you very much, Sophie. I've just put in the chat, hopefully all panelists and attendees can see the government's updated guidance for visits to care homes, updated today.
Thank you.
And one of the things that I know is that many smaller companies which own care homes, and some care homes are owned, their family businesses, are really struggling to write policies. They have no capacity really to do so. And I know that some care homes simply don't have anything like a written policy. They've just banned visits, which is obviously inappropriate, but they feel that they're not getting the help from the government that they need, or from local authorities for that matter. Right, Alexis, do you want to come in here?
Yeah, sorry, let me just put my microphone. So, I mean, I think it's not just about being visited from an autistic and learning disabled perspective and from a disabled perspective. It's about going out as well. And of course, we know that staffing is going to be a problem, rota is going to be a problem, but those things, you know, it shouldn't take away our rights and these kind of feelings that you get actually of it, basically imprisonment, you know, and hopelessness. And for autistic people, you know, the sensory charge dynamics of a ward are really hard to tolerate. And that in itself, being locked in all day and not having access to the outside, just creates a lot of overload. And for us, that's very painful. Like for me, it feels like my skin's on fire, my ears and my eyes are burning. And we're not allowed to use our usual coping mechanisms. And this is what leads to meltdown, and this is what leads to restraint, and this is what leads to seclusion, and this is what actually leads to the inhumane and degrading treatment that we suffer. You know, as soon as you know you have this meltdown, which is entirely avoidable if the right things are put in place, you have like 6 to 10 people holding you down, and you'll be like forcibly medicated and then locked in a room for a couple of days. And I just feel like all of that, you know, it's just very inhumane. And, you know, these blanket bans on visitation, but also our ability to leave, you know, magnifies feelings of invisibility and worthlessness. And I just think that it sets up a perfect storm when nobody's watching.
Thank you very much. And you mentioned in your earlier intervention, Alexis, and I think Veronica as well, that in England, the Care Quality Commission, the CQC, decided in mid-March to stop its regular inspections of both mental health units and care homes. Coupled with that, we had the bans on visits by friends and relatives, plus statutory advocates also stopped going in. And so several people in the international human rights community have commented at the global level that really created the perfect storm for potentially abuse and neglect, and took away some of the safeguards that we all thought were sort of permanent fixtures of ensuring that there's no ill treatment in closed institutions. I'm going to now turn to an incredibly important topic, and that's the experience of Black, Asian and minority ethnic residents, but also staff. And I know, Subhajt, you've been looking into this. So can I turn to you, please, to share your thoughts and your analysis?
Thank you, Oliver. Before I talk about the BAME group, I just want to make one small comment regarding healthcare and social care. And particularly, Veronica highlighted it, that social care always played a second fiddle to the healthcare. I did some work for the Northern Ireland government a few years ago on integrated care system. Northern Ireland's supposed to have an integrated care system. We're supposed to have an integrated care system, and in situation like this, it is supposed to work seamlessly. And it shows that our long-term lack of planning has created this, you know, discharge from hospitals without testing into care system, which was completely inadequate to deal with. So that is one comment I really wanted to make. We clearly know there is evidence to suggest that BAME communities suffer disproportionately because of this pandemic. I'm going to talk a little bit first about the NHS staff. From my personal point of view, a large number of members of my family work in NHS. My elder brother was one of the first to be infected. A consultant in one of Nottingham hospitals got infected because there was no PPE. He didn't even know when he was operating the patient that the patient was suffering from COVID-19. And it only came into public attention towards the end of March and beginning of April, when one of the tabloids actually first reported that the first 11 doctors to have died from COVID-19, all of them from the BAME community, which was shocking. But when I spoke with my friends and members of my family working in NHS, it didn't surprise them at all. If you look at the wider healthcare fatalities among the wider healthcare workers, it gets worse. by end of April, 71% of the nurses who were dying, and nurses were dying disproportionately again. Any loss of life is sad, but I'm just highlighting the BAME peril here. 71% were from the BAME community. Now, interestingly, it was end of June, starting of July, British Medical Association published a research report. And that research report highlighted two very alarming issues. And it's alarming because it kind of plays into the minority psychology. And one of the reasons BMA found that why so many ethnic minority, Black ethnic minority doctors and nurses were getting infected. The first reason was a lot of doctors, nurses from this group, or key workers from this group, were pressurized to work with patients or patients having high risk in high risk setting without adequate PPE. And the second alarming thing that came out from this research and report by BMA was they were less likely, twice less likely to complain or raise a concern to a senior management authority or a management in a senior position because they were simply scared. So a fear factor flows through the system. And unfortunately, this is not just happening within the healthcare sector. This happened all throughout in every part of the society. And it can be seen if you see how many key workers from Black and ethnic minority background got infected because of COVID-19. And that is also quite alarming. The other point I would like to kind of highlight when it comes around to Black and ethnic minority people in the care setting, I think Alexis talked about it, Veronica said, Sophia also said about it, Aswini also has said about it, is this issue of social isolation. A lot of Black ethnic minority people, coming from the same community, we habituated of living with, multi-generational atmosphere, live with our grandparents, our parents. So the isolation that was created without thinking through created a lot of problem for this particular group, sadly for this particular group, and resulted in a much higher death rate.
Thank you so much, Subhajt. You've really highlighted some of the pre-existing structural inequalities, particularly interesting and alarming that people from BAME backgrounds, one of the reasons that they're more likely to be infected, you said it was found that they're less likely to raise complaints and concerns. Would any of the panelists like to respond to anything Subhajt has mentioned on this topic?
I might just say this, which is that one of the things I think is right, Subhajt, is that this whole episode now has highlighted the long-standing inequalities in the health service towards BAME people, and we're hearing more and more stories of other areas of health practice, so in maternal services and so on, where BAME patients receive a substandard or a different treatment which does not take into account the particularities, of their ethnicity. And it may be, let's hope that, now that this is coming to the fore, that this is something that people will be talking more about and will start impacting on service policy and change. But yes, it's been pervasive, hasn't it?
Thank you very much. We're going to move on to look at the challenges that bereaved families have faced in accessing justice. I'm going to turn to you, Amos, and maybe you could pick up and continue the story that you started explaining in respect to your grandmother's death.
Sure. Well, since my grandmother's death and funeral, and obviously more information has become more widely available in terms of the failures and issues surrounding care homes and government policy. We've tried to obtain information, and the hardest problem is obtaining that information. So far, we haven't been particularly successful. The level of secrecy has made it extremely difficult and frustrating at times. And there's a distinct lack of transparency, really. I've written to them with detailed questions regarding the infection, numbers of discharges, use of PPE, results of tests, including staff and residents, made freedom from information requests, but they've largely been unanswered. They suggested that initially I wasn't entitled to the information as I wasn't my grandmother's lasting power of attorney, which isn't a relevant consideration. And despite what we heard about the care home, cases of COVID, the fact that it's been in and out of lockdown due to cases, they continue to deny an incidence of COVID-19. In fact, they claimed that in response to one of the questions that I raised, that the cause of my grandmother's death was frailty of old age, even though we had the death certificate. And so we wanted to try and establish what had happened, and their response was immediately defensive. My intention certainly wasn't to try and attribute blame to the care home. I know how tough it was at times for care homes at the beginning of the pandemic, but the culture, the lack of any transparency and information certainly made it difficult. But like many others, we just wanted answers to those questions. And the matter has now been reported to the coroner, but even that wasn't straightforward. It took writing to 3 coroners in 3 different coronial areas, and on a number of occasions, each asserting that a different area was responsible. So eventually, one of the coronial areas decided to take on the pre-investigation, even though they said, it strictly speaking, it wasn't their area, but clearly there was a discussion between the different areas. Now we await the results of the pre-investigation inquiries. There's certainly no guarantee they will open an investigation, given the circumstances and the lack of information, which is the key problem. And I'm sure that many families are in exactly the same position. And I'm just reading on the chat here that I think many families are in exactly the same position, and several people have raised sort of secrecy. Other people have said that they've been lied to by care homes, etc. Veronica, I can see you nodding. And Amos, I know that you're in touch with the COVID-19 Bereaved Families for Justice group, who's setting up a sort of subgroup in relation to care homes. Is that the experience of people in the group? And sort of, could you give an account of the different sort of categories of challenges that families are facing to access justice on behalf of loved ones who've died of COVID-19 in care homes? Yeah, I think it is pretty common. And as I say, more information has come to light now, which makes it easier to look back and to look at and to put them into categories, really. But at the time, as I say, it all happened very quickly in stressful circumstances when you're grieving, and you don't know the extent of it then. But certainly the group, there seems to be a lot of similar experiences, and in fact there is a meeting for the care home subgroup of the COVID Bereaved Families for Justice next Tuesday. I think that's one thing that they'll be looking at, is what you can do in that situation, and certainly I think it's something that I'll benefit from. Thank you very much. Veronica, what's Hourglass's experience of assisting families to get information?
Well, even long before the pandemic, Hourglass was campaigning for better outcomes for older people as victims of crime and abuse. So I can see the very clear parallels here. You know, I have to agree with everything that Amos said, and it just sounds so familiar to me. Families feeling that they've been lied to, that there's been cover-ups, that they haven't got the truth around their loved one's death. One woman described just how painful it is for her that she doesn't know the exact time her mother died. You know, so just even accessing those pieces of information that are so precious. I suppose the other thing that struck me listening to Amos and his family's story and journey, I suppose I'd like to say, Amos, as a barrister, clearly familiar with the whole legal system and experiencing such challenge, how much more difficult then it is for ordinary people just like me and anyone else to access the legal system, which is complex for people outside it. Families would regularly tell us they don't know the route into the legal system, they don't know where to get the information. Once they're in the system, they find it overwhelming. And in many cases, it just feels too overwhelming for families to proceed. And sometimes it is easier for them and their mental health to just withdraw. And that's not justice for the deceased or for their families.
Thank you so much. And thank you to everyone who's writing in the chat. So just to summarize some of the interventions there, because it's only the panelists who can see them. One person said that the government's reduced community hospitals and thereby the potential for patient flow to community hospitals, ill-equipped private care providers. There's a comment about people going to care homes across the border with Scotland, increasing the traffic, which was against the Scottish lockdown rules. Another person's explained their difficulties trying to establish the circumstances in which their father died in a sheltered scheme with extra care staff. And then Subhajt, someone else has said that what you've said resonates with them as a BAME NHS doctor. And that person has said a fine example, their experience, a fine example of institutionalized racism in the NHS. Veronica, you mentioned in your remarks just now the word justice. So we're going to spend the rest of the webinar exploring what does justice look like for families and friends who have lost loved ones in the pandemic in care homes. So we're now going to hopefully try and demystify and explain some of the various legal processes. And I encourage the audience members to ask questions in the chat. I know that the various different legal processes can be quite mystifying. So I'm going to ask you, Aswini. The Prime Minister has already committed to holding a statutory or public inquiry. Could you explain what that is, please?
Yes, well, I'll try, and I'm just listening to Veronica. It strikes me how odd it must seem to people who've suffered what we're hearing about, that you don't automatically get someone to really inquire into why. So a statutory inquiry is a public inquiry that's been placed on a statutory footing under the Inquiries Act 2005 and its rules. In this context that we're speaking about, where tens of thousands of people have died or been seriously harmed as a result of COVID, and government responses have been criticised or could be held to be wanting, and where there is a risk of more deaths and harm, the duty to investigate is underpinned by the state's obligations under Article 2, we've heard of already, right to life, and also in Article 3, the prohibition on torture and inhuman and degrading treatment. I hope this doesn't get too dry for everyone, but it is important. Focusing on the right to life, the duty to investigate arises whenever there is an arguable case that there's been a breach of the positive and negative duties to protect life. One way of discharging the duty to investigate is for the Prime Minister to set up a public inquiry under the Inquiries Act 2005. And of course, he said he will at some point, but we just don't know when, and he certainly doesn't have any intention to do it now. But let's face it, there is an overwhelming public interest in not only understanding the causes of the many, many deaths in the UK and in preventing further deaths, because the pandemic is not yet over, sadly. What the public are concerned to know, we're hearing, is whether these deaths have been caused or contributed to by the multiple failings of various public authorities. the focus is on the highest levels of government and the Department of Health and other health and social care bodies, such as the now defunct Public Health England. There are some key questions that are continually being posed in the press and social media. The list is long and familiar, and I think it's worth summarising some of the key points. Was the UK properly prepared for a pandemic that was foreseeable? What were the plans and policies in place? Did they reflect scientific knowledge and advice? Did they comply with the UK's international commitments and adequately take into account the needs of the elderly, people with disabilities, BAME people, and those living in congregated care? Was lockdown in March conducted in a timely fashion? And should the UK have lockdown sooner and for longer? Have restrictions been clearly explained, lawfully imposed and enforced? Was testing introduced quickly enough? Is testing and tracing capacity adequate? And crucially, what lessons can be learned for the future? So we and many others say that Article 2 and 3 mandate the establishment of a public inquiry to answer these questions and more. It is arguable, we say, that the UK has breached its obligations to protect the lives of the public and to prevent them from suffering serious illness with often long-term health complications by its inadequate responses in the pandemic. This all means that Article 2 places a procedural duty on the government to investigate through a prompt, effective and independent inquiry. It's probably important to note that the common law, and not just human rights law, also requires a meaningful public investigation in these sorts of circumstances. There are other methods, but this means that such an inquiry has been specifically provided for by the Inquiries Act. A public inquiry has many important benefits that other forms of investigation lack. So, for example, it signifies, for example, the seriousness and importance with which the government is treating the issue. This will in turn promote public confidence. There's a broad power to set terms of reference to identify the matters for investigation. An independent and impartial chair and panel will also be important in that regard, allaying fears of political influence. The Act gives the chair powers to compel the disclosure of documents, compel oral testimony taken on oath. And crucially, effective participation of bereaved families may be achieved by designating them core participants and providing funding for legal representation. Importantly, there is sufficient flexibility for such an inquiry to adapt its procedures and respond speedily to meet the prevailing needs. And that's all been provided for in the Inquiries Act 2005.
Thank you, Aswini. That was very comprehensive. So I've been corrected in the chat. So my understanding now is that the Prime Minister hasn't mentioned the word statutory or public. He's just said that there will be an independent inquiry. So now we know what a statutory inquiry entails and what the elements are. It sounds, Aswini, that this inquiry might take years and years and years to deliver a report, by which time the pandemic may be over. So there are many calls, including from some political parties and from civil society, that the inquiry should have an interim phase where some recommendations are made more speedily. Could you just explain how that might happen? What would that look like?
Yes, so that's true. Some inquiries take a long time, but there is an ability to report speedily. And it does not need to take the 12 years that the Bloody Sunday inquiry did to achieve that a really good outcome and a useful outcome. And the first point is that the time to learn lessons is now, because people are still falling ill and dying. And we're in the process of a second wave of infection, and over 13 million people in this country are once again under lockdown restrictions, and more restrictions, we are told, are imminent. And also the frightening fact, winter is around the corner. So an inquiry under the Act can be set up quickly, and it can start its work within days. And terms of reference may be set to identify the inquiry's work. I've already mentioned those. and may include a mandate to consider current and future steps to deal with the ongoing crisis and to make recommendations to improve responses to help in a second wave and to prevent future deaths and illnesses. And this enables the chair to deliver an interim report following what you've called an interim phase of the inquiry. And this seems like the most crucial step where clear lessons need to be learned from the past handling of the pandemic. This has been done before, it's nothing new. There's the Taylor inquiry into the Hillsborough Stadium disaster, and more recently the Grenfell inquiry did the same thing. And where an urgent response is needed and entirely possible, this can be set up. The need for a prompt investigation is also inherent in Article 2, which I've already mentioned, is the right to protect life, duty to protect life, and also is supported by case law under that article. And that's because, as I've said, people are continuing to die, and it remains arguable that the state is still in breach of its obligations to protect them, and this is ongoing. There's a need, as we say, to prevent future deaths, and also the scale, given the scale of the loss already, this cannot be overstating the importance of trying to protect future deaths. And the very purpose of an Article 2 investigation is to prevent recurrence and expose culpable and discreditable conduct. And the sooner an investigation starts, the better. It demonstrates good faith. It won't drag out the awfulness of the experiences that we're hearing about. It'll provide, importantly, again, swift catharsis and the restoration of dignity. So yes, it's all, I think an interim phase is entirely possible and seems to be really well suited to the current situation.
Thank you very much. Unfortunately, Alexis had to drop out due to childcare commitments, but we thank her for her participation. Aswini, I know that there are several parliamentary committees holding inquiries into various kind of COVID-related issues. In your view, do those parliamentary committee inquiries replace, could they replace a statutory or public inquiry?
Well, I think the short answer to that is no, but that's not to undermine the fact that these parliamentary inquiries are an essential part of the Parliament's function to scrutinise legislation and policy. They're conducted by select committees, which can be appointed by the House of Commons or the House of Lords, or as a joint committee, like the Joint Committee for Human Rights. And they're specialised committees of investigation, which have apparently existed since Tudor times, but in their modern emanation since about 1979. And you will see, if you look at committees.parliament.uk, that there are pages and pages of ongoing committee inquiries. And some examples of those that are happening currently during the pandemic are to be found in the Women and Equalities Committee, which is conducting an inquiry into the unequal impact of COVID on people with protected characteristics. And that started taking evidence in March, and you can watch all the meetings online, so it's fairly inclusive from that point of view. The Joint Committee on Human Rights has 2 ongoing inquiries, and one concerns the government's response to COVID and the human rights implications. But I mean, I suppose the question is why aren't such inquiries good enough? You know, these are, as I've said, parliamentary business. They're chaired and conducted by MPs with party allegiances. So they don't really have the requisite degree of independence that a public inquiry does. That's one point, Oliver. They don't operate procedures that promote the effective participation of families or victims, which I've already highlighted is a really key part of effective participation and an inquiry. Parliamentary inquiries are not actually set up to provide the public accountability that the Inquiries Act is specifically intended to provide. And so as such, they don't really satisfy the procedural obligations under Article 2. And whilst they appear to be governed by some convention, I certainly couldn't find any really proper written procedures for them. There is a standing order that provides for some of their procedures, but that lack of written procedures makes their working somewhat opaque to the public, I would say. And despite fetching YouTube videos trying to explain how they work, it doesn't really help to understand how witnesses and how that whole experience will work, although they do have powers to call for evidence and records and so forth. And the government must respond to a report, usually within 2 months. But there again, you see, the government doesn't take part in the inquiry itself, which it would do in a public inquiry. So I would say that the obviously key limitations here, especially, are the where the procedural obligations under Article 2 are not satisfied.
Thank you very much. Let me turn to Sophie. Sophie, what's an inquest? And will there be an inquest into each death by a resident in a care home due to COVID-19?
Almost certainly not, is the short answer to the second part of what you asked. Inquests are carried out, well, must be carried out if a coroner has reason to suspect that the person who died of violent or unnatural death, or the cause of death is unknown, or that person died in custody or in state detention. So if we look at somebody in a care home who's died from COVID, they're not in state detention unless they're detained under the Mental Health Act. Being under DOLS or detained under the MCA doesn't count as state detention for the purpose of the inquisitorial system, inquest system. And therefore you look at, well, is there reason to suspect that the death is violent or unnatural? Now, reason to suspect is a pretty low threshold. And the Chief Coroner has issued some guidance on inquests and COVID-19, guidance number 37. Controversially, he started the guidance by saying that the vast majority of deaths from COVID are due to a natural progression of a naturally occurring disease and so won't be referred to the coroner. Well, that's probably true, but you know, whether it's helpful to kind of make that such a clear kind of presumption, I think, is another matter. The guidance does go on to say that, of course, the Notification of Deaths Regulations 2019 requires a report to the coroner if the death was due to a disease attributable to the deceased's employment. So the guidance goes on and says, well, in some cases, the death of a frontline worker might find its way to a coroner's inquest. Also, a death from natural causes, so a naturally progressing illness such as COVID-19, might be an unnatural death if there's reason to suspect that culpable human failing contributed to that particular death. And the guidance does go on to say that matters, you know, national policy, national resources could form part of that. So it's not impossible that there might be an inquest in relation to a care home death if there's reason to believe that shortages of PPE contributed to that. But I don't know how many deaths are being referred to the coroner. I know that the charity inquest has got some real concerns as to whether deaths that should be investigated are in fact being investigated. And I think the last thing to say about inquests is that the funding arrangements are quite difficult. If you're not able to fund the representation yourself, there's legal aid available in pretty limited circumstances, and again, in almost all cases, it's means tested. So they're not necessarily the easiest forums in which people can participate.
Thank you, Sophie. Another type of legal claim is a civil claim. So might you be able to explain what a civil claim is and what that sort of litigation would look like?
Yeah, so I mean, there'll be civil claims will sometimes follow a death. They might be brought on the basis that someone has been negligent in causing, and as a result, the death was caused. They might also be brought on the basis that there's been a violation of Article 2 of the European Convention on Human Rights, which both Aswini, several of us have been talking about, particularly Aswini most recently. In all cases, the claim could be brought either by a family member representing the deceased's estate, or by some family members in their own rights, might be brought against care home providers in certain circumstances, or against statutory bodies such as trusts, and a successful claim may result in damages. If it's a claim that's brought under Article 2, then if the court finds there's been a violation, the court has got the option to award, to make an award if it's necessary to give the victim just satisfaction. So there's this concept of just satisfaction for a human rights violation, and that might be financial, but it might not be financial. It might be other, something else that was considered to give that person satisfaction. And that perhaps allows a slightly more sort of restorative approach to be taken, looking for apologies, looking for explanations. Either way, legal aid is very limited, and in the vast majority of such cases, if you bring a civil claim and you're not successful, then you're potentially going to be looking at paying the costs of the defendant who's successfully defended the claim, unless you have either the benefit of a legal aid certificate, or you've managed to get some kind of insurance against that possibility. So again, a difficult remedy, bringing with it a number of risks to the claimants. I don't know whether Aswini or Amos want to say anything further that I may have missed out, or that they might want to add.
No, they're both shaking their heads. Thank you so much, Sophie. An incredibly erudite explanation of really complicated matters there. So obviously all we can do on this webinar is provide some basic details, but of course, if people would like to find out more about civil claims, etc., that they should contact solicitors, specialist solicitors in the first instance. I'm going to move on because we've got 10 minutes left. Amos, you've mentioned already the COVID-19 Bereaved Families for Justice. Would you like to explain how people might be able to support the group, and what members of the public can do to support bereaved families, please?
Yes, absolutely. Well, the group is set up, and I'll try and copy and paste the website address. But the group is set up by and on behalf of family members, and it's been key in highlighting the relevant issues to MPs and members of the public via TV and media. I think the group's got over 1,800 members now. It continues to exert pressure on the government to hold a statutory public inquiry with a rapid review phase, so that those lessons can be learned quickly. Members of the group have given evidence before the all-party parliamentary group on coronavirus. It's certainly been in the press that one of the founding members of the group has written to the Prime Minister and Health Secretary on a number of occasions, inviting them to meet with them. Keir Starmer, in fact, has done, and in fact it was the subject of questions at Prime Minister's question times, but having initially said that he would meet the group, he later then retracted that in the press. Certainly the polls indicate public support for a public inquiry, and there seems to be political support across the parties, including even from MPs within the government. The group has the benefits of an experienced legal team, including yourself and also Brodie Jackson Cantor solicitors. And I understand that a pre-action letter has been sent to the government in relation to a potential judicial review of the decision not to hold a public inquiry. The group is entirely crowdfunded and proceedings can't be issued in effect until sufficient funds are raised. And so I'll place the link again, if I can, in the chat. But that's certainly one of the ways to support that. Just bear with me a moment.
Thanks, Amos.
Is to donate, but also there is a petition in support of an inquiry. Again, at the website, there is information on the website about how you can do that. In fact, that's the website address. Also on that website, details of a Facebook page. Family members can join the Facebook page, and there's a lot of information there as well. The page contains some really useful information on how to access bereavement support. There also, if you on that site register, then there is available a newsletter which should contain details, including letter templates of how to write to your coroner, to write to MPs, and it also advertises upcoming events, including the care homes event that I've mentioned already.
Thank you so much. So just as a wrap up to this webinar, I'd like to ask each of the panelists, please, just in one sentence, to explain what justice for bereaved families of people who've died in care homes looks like. Can I turn to Veronica first, please?
Well, the charity would be fully supportive of an independent statutory inquiry to look at the systemic failures, lag in government policy, and the urgent need to learn lessons quickly, as we're facing a second wave. We haven't learned from the first wave yet, and older people really must be prioritised. Just as I've listened today, I think it's really important that families have their voice heard, but I also think that we really should be listening to older people and give them an opportunity, having lived through this nightmare, give them an opportunity to have their voice heard too.
So in one word, perhaps participation of people
Yes.
in care homes,
Absolutely.
as well as their families, for those who have families. Thank you. Sophie?
Well, I would agree with everything that's just been said. And one thing I would particularly want the inquiry to look at is the guidance that's been given, tracking through the kind of real, chaos really of contradiction and muddle. And I think that has just allowed the situation to be so much worse than it needed to have been. So I'd want to see that really being focused on very, very carefully.
Thank you. Amos?
For me, I think it's gaining answers to questions. It's also learning lessons and preventing repetition of the same errors and mistakes.
Thank you. Subhajt?
I would start by saying, I agree with Ashwin and Sophie and Veronica and Amos. The government has a legal duty to hold public inquiry. It also has a moral duty and moral responsibility to hold a public inquiry that will bring back trust and transparency. Because everybody who has lost life is not just statistics. Somebody's loved one has left a vacant space. Every doctor who had suffered through, every health worker who had suffered through unnecessarily because the government was unprepared, has contributed a lot, sometimes risking their own lives. And they have a right to know what went wrong, who knew what and when, and why it went wrong, so that we can learn from the mistakes. And the mistakes has to be learned very soon. From a BAME point of view, I would also like to say that the government has a legal duty and a responsibility to reduce inequalities in society. COVID-19 didn't create the inequalities. The inequalities were always there.
Thank you. And finally, Aswini, please.
Well, how difficult to follow all of that. But obviously, I agree with everything that's been said. And I would add to points such as questions answered and lessons learned by saying, I think justice has to be speedy. The opportunity has to be grasped to prevent any more deaths. I think it's got to be compassionate and offer catharsis, but not just that, but also to, I think, to possibly show people that the deaths of their loved ones haven't been in vain, and that some positive lessons can be learned from them, even now.
Well, thank you so much to all of my fellow panelists. And can I thank everyone who has joined us from around the country. And as I said, it's clear from the chats that many people have lost loved ones in care homes, and our condolences to you. Thank you very much for joining this Doughty Street Chambers webinar. If you'd like further information or to get in touch with any of us, feel free to email any of us or contact us on Twitter. All of us are on Twitter. We look forward to future interactions, and thank you very much.